Could you imagine having suicidal type face pain? My next patient had trigeminal neuralgia, also called tic douloureux, and that's when the nerves of the face become inflamed and cause horrible, horrible pain. It's very, very difficult to get rid of, but luckily we were able to help this individual. So let's take a look at him. All right, Mr. Michael. So you came in for tic douloureux or trigeminal neuralgia. Tell us a little bit about how, or because originally you didn't know what you had. You just had pain. Tell me what you had and what you were experiencing.
So one morning I woke up and I had a pain right at the roof of my mouth in the front. And so I'd had root canal before, so it felt very similar to that. And so I went to my dentist and they got me in and they looked at it and they couldn't find any root issues or anything with my teeth. But they sent me to a specialist because the pain was still there. So I went to a specialist and he took x-rays and looked at it. He said, no, it's not your teeth. He said, I think it's your nerves. He said, I think what you've got is trigeminal neuralgia. I said, I don't know what it is, but I know it's painful. And so I actually called my mom, and she has a good friend who's a chiropractor, and I called her, and she said, well, I think what you have is trigeminal neuralgia. I think the guy's right. He said, we can help fix that. So she recommended I come see a chiropractor here in Rockwall. So I did, and we've worked on it. It's done phenomenal.
Yeah, it's pretty interesting that, like a lot of cases, it's not simply just one area of the spine per se. So when he came in, we did a complete set of x-rays, a very thorough analysis, and we found pressure at multiple levels. And because of the severe face pain, he started chewing on the opposite side, thinking that maybe he was messing his jaw up. So initially, we actually worked on his jaw a little bit too, but once we had that discussion and kind of asked him what he was doing different, and that he was chewing on that, when he stopped that, the jaw stopped showing up. So we really haven't had to do a lot on his jaw since then, but he did have upper cervical pressure, which is very common with tic douloureux. But the thing that helps him the most now is actually the lower cervical seems to be his major. So a lot of times you'll get upper cervical pain or symptoms coming from the upper cervical, but it's in response to something lower, because the upper cervical compensates to keep your eyes level. So if you're distorted posturally down lower because of damage, your upper neck's going to torque itself to bring your eyes back to level, and that's oftentimes what hurts and causes symptoms. So when we keep this under control, he typically doesn't have any more problems. But just like everything, I wish we could eliminate it 100%, but spinal weakness still exists. So if he doesn't keep up with it, or if something happens where he does, do something to irritate or re-injure that area, it will start to come back, but we can usually jump right on top of it and get it down again. So that's why we check him on a regular basis now. So I'm still finding pressure in his.
Right.
Yeah. Now it's a little sharper, right?
Yeah. And then I ice each night for about 15 minutes before I go to bed. That helps.
Yeah, that ice is a lifesaver if you can. The joints, typically you'll get symptomatic or the symptoms when the joint is swollen. And, if it's healed up or doing really well, it typically is not swelling. But when you do something that triggers that swelling, that's when it gets bad. So ice is like our first aid bandage. So we're like, ice, for 30 minutes if you can, up here maybe 15 minutes, but 30 minutes of ice will a lot of times help put a Band-Aid on it so you can get in. So I did find pressure here and here today, so we're going to work on those. Let's see how it goes. Right, we're going to set this one here.
The first one.
We're going to adjust it precisely according to how it's misaligned on his film. It's one of the hallmarks of the Gonstead work. All right, you just relax it. We're going to set it up here. Perfect. Great. Let's recheck the motion. I don't care how it sounds. If it's not moving better, I didn't do a good job. But that's moving better, so good. Excellent. Okay, now we're going to do that one in the middle back.
Okay.
All right. That's good right there. at your shoulder. Perfect. Great. All right, we got him all adjusted up. Muscles feel good. The motion's definitely better on that one. So, yeah, he does really, really well. Like I said, the areas that seem to affect him the most, if you see, this is his spine. It's, you know, it should be perfectly straight, but it's got some places where it kinks. But especially when you get here to his mid-back, you'll see that it takes a hard deviation to the left. So that mid-back area of nerve pressure and injury sets the neck up quite a bit to be compensating and have problems. But the pressure we find here and here typically help him the most. But early on, you can see that even here, as the spine's going this way, when you get to the upper neck, it starts coming back to bring it back to level. So that's why you get so much problem in the upper cervical sometimes from all that. So anyway, he did great.